For 10 years, I've been putting my husband on airplanes headed for Honduras with Missoula Medical Aid. Last month, I finally joined a brigade myself and helped out for 2 weeks in health clinics in southern Honduras. I'll tell you, nothing can really prepare you for modern Central America. You land in Honduras and deplane directly onto the tarmac. Your body absorbs a shock of hot, dry air and bright, unfiltered sunlight. You enter the terminal, and it's an immediate confusion of Spanish in your ears, a cluster of bag handling, finding transport, nodding, smiling, trying to say gracias, wanting one of those bananas someone is selling. Finally, you're in a car at street level in the Honduras capital, Tegucigalpa. The city is a complete and apparently permanent traffic gridlock, punctuated by near-death experiences as your driver darts into brief traffic openings. Finally, the road widens out. You're leaving the city, climbing and winding through hot, bright hills. Life is just on display. Little houses hang right next to the road, their perimeters strung with barbed wire and hung with laundry. Kids and pigs and dogs and bikes straggle along the roadside. Women with a tub of something on their heads, men in rubber shoes trudging along. Weird buzzard-like birds are ubiquitous, and you try to memorize the confusing Spanish syllables, something like zopilotes. And you ask so many questions. Who owns the forest land? How do these houses get water? Do all cars here use the middle lane to pass? It's all buzzing by you, but every once in a while, your mind freeze-frames an image, like a skinny old lady sitting perfectly still in the brown dust under a big, dry tree. And you've only been in Honduras for 60 minutes. Missoula Medical Aid works with the international agency, Save the Children. They line up a different town for a free public health clinic for each of the 10 days that we work in Honduras. Our crew of 14 would arrive in 2 trucks in front of a little rural school. This was usually just one room lighted by sunlight coming through unglassed windows. People would be walking in for the clinic from the hills all around. They lined up outside while we hauled in our boxes and set up 4 or 5 exam stations at school tables. We would curtain off a corner and requisition some kind of table for women's exams. And away we'd go. The clinics are a crush of humanity, with lots of people waiting and lots of people being served at all the stations. It's a noisy flurry that settles into a rhythm, but at first it is confusing and overwhelming. You find yourself sitting at a low school table with a Honduran mom and several kids she'd like the doctor to see. The kids are squirming close to mom, their eyes wide and their mouths clamped shut. You struggle to navigate the encounter in Spanish, but more, you feel keenly the natural shyness of the woman in front of you, the humility of her situation, the stark outlines of her work leading family life when there's exactly enough to eat but no more, and the necessity in this one woman's life of bearing her needs to you, a stranger that she will never see again, but who has all the medicine, all the vitamins, and perhaps some antibiotics that can help her and her kids. I will confess that I was afraid of this. I am a squeamish person, and poverty is one of those things I hate to look at. But a very practical and magical thing happened to me during my very first day with Missoula Medical Aid. I looked at the Honduran woman sitting across from me, and all I saw was a mom, just like me. I smiled and apologized for speaking Spanish so poorly. I took a close look at her kids and guessed their ages. I complimented the health of the baby. I knew her. I knew her life as a mom, and her life didn't scare me anymore. I ended up having this encounter dozens of times each day, with one mom or dad or teenager after another. My only real job was to be present and pay attention to the people in front of me as the doctors did their work. They are real people living real lives, and at the end of the day, it's a good day if the people we love are fed and healthy. As the poem says, our feet are sore, our daughters are tall. The repetition of this simple realization was profoundly moving. Don't get me wrong. Rural Honduras is a heartbreaking place. Everyone is kind of chronically malnourished, susceptible to infection, worms, disease. If you have diabetes, you won't always have medicine. They just run out. If you need surgery, your family has to pay cash in advance for hospital medications. Your choices of work are subsistence farm labor, or in some places shrimp or salt processing. Your choices of food are just as simple: rice, beans, tortillas, an occasional egg, a rare chicken. Most people have a relative or two in the United States, referred to without shame as mojados, or wetbacks. I was musing on all this one day, sitting in the hot, crowded Missoula Medical Aid clinic room. I was thinking about everyone walking to the clinic and doing their farm work with donkeys and hoes and hand tools, hauling their water from a cistern outside the house, and I thought, wow, other than the logo T-shirts someone sent here from the States and the plastic Coke bottles that are everywhere, these people have lived and looked exactly the same for generations. Their crops are the same, their houses are the same. I knew that their kids' lives will likely be the same. The face of poverty has not changed, I thought with a shock, for thousands of years. I felt frozen in place, a tiny witness to a timeless human story. This must be the long arc of history that Martin Luther King invoked. My head spun trying to fit my little efforts into the bigger picture. I knew we were doing good working at the health clinics, but I had no illusions that we were fixing anything big. We were addressing today's worms and fevers and earaches. Was that enough? Maybe we were at least bending that arc of human history, ever so slightly, in the right direction. But I couldn't grab onto that purpose. I turned my attention back to the family in front of me, and things got clear again. At the presenting moment, the attention of one Missoula Medical Aid doctor to one family, and a bag of free aspirin, that was enough. It was just enough for me and for the mom across the table. I smiled to her as she gathered up her kids for the long walk home. This is Rosalie Sheehy Cates, President of the Montana Community Development Corporation.